Okay. Hi, my name is Tanisha McAdams, and I'm here to tell you today about Brucella. Brucella is a gram-negative bacteria. It's Cucurbitacilli, which means that it's a short rod shape. The measurements are usually 0.6 to 1.5 micrometers by 5 to 7 tenths of a micrometer. A micrometer is actually a millionth of a meter. Um, Brucella are non-motile. They have no flagella. They're non-sporing, and they lack capsules. Okay. Transmission of Brucella can happen in one of three ways. It can happen through ingestion, inhalation, or entrance through open wounds. We'll talk about ingestion first. Ingestion can happen through consuming undercooked meats or non-pasteurized or underpasteurized uh, dairy products such as ice cream, cheese, or milk. This is the most common way to become infected. Animals that are contaminated with Brucella provide byproducts that are contaminated. So these animals include sheep, goats, cows, and camels. Um, this can also include elk and moose. Inhalation can occur in a laboratory setting or in a slaughterhouse or in a meatpacking industry. Um, this can lead to infection if a microbiologist is looking for antibiotics and such, and they're working with the brucella, they can contract brucellosis just through inhalation. The slaughterhouse and meat packers come into contact with any blood-borne agents and get brucellosis. Wounds or open skin can actually happen to the slaughterhouse workers and the people working in the meatpacking industry, and also to veterinarians who are working with an ill animal, or hunters who come into contact with an infected animal. So here's some work-related risks. I've already gone over several of them. The meatpacking industry, slaughterhouses, laboratories, veterinarians who may come into contact with any sick animals, wild or domesticated, and hunters who may come into contact with the contaminated meat. So some travel risks that are also included with brucellosis. If you travel to any of these regions, Eastern Europe, Latin America, Asia, Africa, the Caribbean, Middle East, or the Mediterranean Sea area, you may actually come into contact with Brucella just through ingestion. The pasteurization requirements in these areas are not as strict as America's requirements, so they may not be pasteurized as long or to the degree that's necessary. Any meat that may not be properly cooked in these areas could also cause illness. They're just not as well regulated as the United States. Signs and symptoms for brucellosis include fever, sweat, malaise, kind of just a down and out feeling, um, anorexia due to loss or lack of appetite, headache, fatigue, pain in muscles and joints and backs. It's kind of a very flu-like feeling, and that's how the brucellosis begins. The more persistent symptoms that tend to recur are fevers. Arthritis can actually be a result of brucellosis, endocarditis, neurological symptoms, chronic fatigue, and swelling of the liver or spleen. Depression is also included in these symptoms, but it stems more from a person's inability to get up and move like they used to, and they become depressed due to the illness. So if you experience these flu-like symptoms, a rapidly rising fever, unusual weakness, um, persistent fever, or any of the risk factors that I previously listed, whether it comes from work or travel, you should follow up with your doctor. Diagnosis actually requires that the organism be isolated. They can test blood or bone marrow for this. A blood culture is the preferred method. Unfortunately, this could take up to a month, and the organism may still fail to grow in the culture. Serology is another method used for diagnosis, but due to the delay from people believing that they have the flu or some type of viral bug, rising titers may actually be missed. X-rays can be used to inspect changes in bone and joints, and the cerebrospinal fluid can be inspected to check for infection. Echocardiography to check for damage in your heart, and a CT or MRI would help identify inflammation or abscesses in the brain or other tissue. The main thing about Brucella is that there's an incubation period of 2 to 10 weeks. So between the 2 to 10 weeks and the month's time that it may take for the organism to be identified, that's 2 to 3 months of a person being ill and not understanding why and not having antibiotics provided for the exact cause. So treatment begins with treating the symptoms until the exact diagnosis is made. Once the diagnosis is made, antibiotics can be provided, and it's usually a triple antibiotic treatment. These antibiotics include doxycycline, gentamicin, streptomycin, rifampin, TMP, SMZ. Those antibiotics actually have a low reoccurrence, a low relapse rate when brucellosis is treated with them. Some other medications that may help are chloramphenicol, tigecycline, and fluoroquinolones. These medications have been proven to help, but there is no record of whether or not they assist in recurrence or not of the condition. And finally, in prevention of brucellosis, the easiest way is to not consume dairy products that have not been pasteurized, and to not consume meats that have been undercooked. There is a vaccination available for animals that would be at risk. Unfortunately, there is no vaccination for humans. The animal vaccination is actually fatal to humans. Another way to prevent it is in a laboratory setting or in a veterinary setting or any of the industries. Use protection and precautions. Use glasses to prevent any bacteria from getting into conjunctiva, or a face mask to prevent any type of interference with your oral mucosa, and gloves to prevent carrying the bacteria back and forth. And hand hygiene is always important in any of these settings. And these are the references that I used for this PowerPoint. And case in link for that's my son, and my daughter is my other audience member. Thank you.